So welcome all. Again, happy Friday. Thank you for joining us. I am Becky Facina with Alliance Health. I'm their community education specialist in their Johnston County office, which is located in Smithfield. Today, I am happy to share, the stage with Hunter Hijma from the Johnston County Public Health Department. He is one of their 3 fabulous health educators over there, and he's going to share some information with us concerning diabetes and smoking cessation, especially some information around smoking and our young people. We have some events coming up that relate to that he'd also like to share. So we'll talk a little bit about that as well. But prior to, I want to talk about us, Alliance Health. Again, we are hosting this event along with the health department. So I wanted to share some information about Alliance Health with you. We are the local management entity managed care organization for public behavioral health care in Durham, Wake, Cumberland, and Johnston counties. And again, I work out of that Johnston County office. We serve approximately 471,000 Medicaid eligible and uninsured individuals among a total population of about 1.7 million people. We manage a network of providers to ensure that quality care is received, as well as help individuals access care and navigate systems, because oftentimes it is the navigation of the systems that can be difficult for our community members. I want to highlight that square on the first slide that you're looking at where it says Hope for NC, that 1-855 number, 587-FIND, F-I-N-D, or 3463. This hotline connects North Carolinians to additional mental health and resilience supports to help them cope and build resilience during times of crisis. It's available to everyone in North Carolina's 100 counties during the COVID-19 crisis. The crisis counseling program is tailored for COVID-19 to provide immediate crisis counseling services to individuals affected by the ongoing COVID-19 public health crisis. This initiative is in partnership with all 7 of the state's LME MCOs and Real Crisis Intervention Incorporated out of Greenville, North Carolina. Hope for NC is available 24 hours a day, 7 days a week in order to speak to a live person. So without further ado, I am going to turn the stage over to Hunter. I'm going to stop sharing my screen, Hunter, and if you want to go ahead and take controls, please feel free to do so.
Awesome. Thank you, Becky.
You're welcome.
Hi, everyone. My name is Hunter, and I am a health educator here at the Johnston County Health Department. I am familiar with a few people on with us today, so it's nice to see all of you. I have put together a little presentation on a couple topics that we have recently seen growth in here at the health department. They are diabetes as well as smoking, in terms of, especially in vaping and youth here in our county. So I'm just going to go ahead and get started with my presentation. Feel free to stop me and ask any questions throughout the presentation. And otherwise, we will stop at the end and we will talk about a few things. So, like I said, this is going to be on diabetes. So here's just some interesting facts for you guys. You don't necessarily realize how many people are affected with diabetes every day and every year. The number is continuously growing. We see that a number of about 4,500 new adult cases are diagnosed every 24 hours, which is astonishing because that is a huge number. If you think about the total number of people, even here in North Carolina, that makes a big difference in how many people are actually being affected by this. Again, 136 people every 24 hours begin treatment for their ending stage renal disease. And the reason why is because diabetes doesn't just affect the blood sugar in the body, it also affects many different areas that cause many different diseases besides the initial disease of diabetes. So on average, about 641 people die from diabetes or a related cause of death every 24 hours, which is, again, for something that I'm sorry, we cut out. For a number of people that we see being affected by this still in 2020 is crazy. We have come a long ways with technology, and I will be sharing a few different things we can offer our patients here in the clinics, and a few options that we do not offer here at the health department, but they are available out privately.
Hunter,
So,
can I pause you for 1 second? Did you want to share your PowerPoint? I wasn't sure if we were supposed to be seeing it or not.
oh, I'm sorry. Are you guys not seeing it?
I don't see it.
Okay, hang on. I'm sorry.
That's okay, no.
Mhm. Here we go.
Perfect. Thank you so much.
I'm sorry about that.
Hey, no worries.
All right, so I will start back over. So this was the beginning, and here we just see some of the statistics I was going over just a few minutes ago. So what is diabetes? Just to give you an idea, it's a metabolic disease in which the body's inability to produce any or not enough insulin, which elevates the glucose level in the blood. So this means one of two things. Either the pancreas does not make enough insulin at all, which would be considered type 1 diabetes, or the cells of which people have do not respond with the insulin normally. This is where we see type 2 come into play. So this is where, as we can see on the following pages, that people with type 2, it's something that develops over time, and we see this in our older adults that come in. And people with type 1 is typically our younger age group who develops diabetes in their teens, sometimes even in their preteens, and then we're seeing it all the way up through adulthood. And I've included a video here just for you guys to get an idea from someone else's perspective.
Diabetes is a disease that occurs when the amount of glucose or blood sugar gets too high. This is glucose, the main source of our body's energy, which comes mostly from the food we eat. Normally, insulin, a hormone made by the pancreas, helps glucose from our food get into our cells to be used for energy. But what happens if we can't produce enough insulin, or we produce none at all? Let's take a look at the pancreas, where insulin is made. With type 1 diabetes, our body's immune system destroys the cells in our pancreas. This means our body can no longer make insulin, and we need to take it daily to live. In type 2 diabetes, either our body doesn't use insulin well, or the pancreas makes some insulin, but not enough to carry sufficient glucose into our cells. Either way, we need to make up the difference by taking insulin or other diabetes medications to control our blood sugar. With either type of diabetes, glucose levels in our blood can get too high, which can lead to health problems, including heart, kidney, nerve, and eye diseases. Though diabetes is serious, it can be managed so it's less likely to cause health problems. For people with diabetes, check your average blood glucose level with an A1C test to determine whether that level is within your target range to reduce health problems. We also need to take our prescribed diabetes medicines, make healthy food and activity choices, manage our blood pressure and cholesterol, and quit smoking to help us live healthier lives. To learn more about diabetes and how you can delay or prevent health problems, visit www.niddk.nih.gov.
All right, so that just gives us a little bit of an understanding and a visual to diabetes and how it's going to affect the body. So like I said, there is two most common forms of diabetes. It's type 1 and type 2. There is also gestational diabetes that we can find in pregnant women, but that is less common. It's more so brought on to them due to the pregnancy. And typically it does go away after the pregnancy, after the 9 months and the baby is born. So just a few things about type 1. Like I said, it's typically a juvenile diabetes diagnosis. It's usually children and young adults that we find who are going to be diagnosed with type 1. It's really when their own immune system destroys the insulin producing cells out of the pancreas, which in return does not allow them to break down the glucose in the bloodstream. About only 5% of people have this form of the disease. A much larger group is type 2, and it is not preventable. It is something that they were born with. They were always going to have type 1 diabetes. When it exposes itself, is different within each individual. It can be later in life or earlier in life. So typically, this is either caused by genetics. We do see that it runs in families, but it also can be just a predisposition to a particular person. And with type 2, like I said, it is the most common form of diabetes. About 90% of all cases come from type 2. We call this adult onset or non-insulin dependent diabetes, and this is because typically it is from habits that an individual has formed throughout their life, which has in return caused their body to produce insulin but not use it properly. This happens when the glucose does not move into the cells, which is the sugar, and they pile up in the bloodstream, and they just cause a high level of sugar or glucose in the blood, and the body is then not able to break it down properly. So some common symptoms that we look out for in terms of diabetes include excessive thirst and hunger, increased urination, fatigue, nausea, blurred vision, dry mouth, and itching. There is a good combination of these in relation to each other. Sometimes individuals only may experience 1 or 2 symptoms. It really depends on that individual case. For predisposition of diabetes, or how this person may develop it, it can either come from genetics, like I had said previously. We do see a family history, especially on the men's side. And we also have noticed that environmental factors are playing a huge role in those that are being diagnosed with diabetes, especially type 2 diabetes. We're finding that those individuals that are not in close contact to healthy grocery stores or the type of information such as doctor's offices, hospitals, schools, all of that, if they're not getting those proper chances at a healthy life, then they're going to possibly have a higher risk of getting type 2 diabetes. Inactivity and the weight gain because of that also puts these people at a higher risk. And anybody that's over the age of 45 automatically just becomes a little bit more susceptible to the disease just because of a change in lifestyle. We do find that African Americans, Hispanics, and Asians typically are at a higher risk. The African American community is where we have been trying to put some efforts into, in particular, just because they are at the highest growth in terms of being diabetic, at least in America. We're noticing it around the other countries as well, just as times have changed, and especially as food habits have changed. So I did want to bring this up. I'm not sure if anybody on the Zoom meeting with us is diabetic, but you may or may not be familiar with a glucose meter. So I have attached a picture here for you guys. We do not have any to demonstrate in the clinics at the moment, but I did want to just go over this. How this works is you have a finger prick that draws blood, and it just goes on the edge of the meter stick right here. What that does is allows the meter to then read the glucose level in the blood. At that point, you're able to document it. And on this diagram I've included, we see the typical blood sugar range for a normal, healthy person. So what this blood glucose number does for us, it allows us to know if it's too low or too high and how to adjust our insulin based off of that. So I have also included some demonstrations here from the health department. A diabetes pen, an insulin pen, as well as a bottle of insulin and a syringe. So if someone's insulin is too high or too low, they can take the appropriate amount of insulin based on their body size and weight and a few other factors. And then they can inject themselves with this needle and pen. We've also now have a self-injectable pen here. And at the health department, we're actually able to go in and use this demonstration pen to show our individuals how to properly use it before they are out on their own with it. But the insulin is pre-filled in these pens. There is a dosage amount already in them. What they can do then is inject this into their body without having to use a syringe and a vial of insulin. That is what we offer here at the health department. There is some newer versions of diabetes materials, such as a Dexcom. That's a popular form of insulin injection, and it's actually a pod that sits on the skin and has a small straw that's put inside the skin, so that way it can adjust the insulin throughout the day with that individual's phone. We unfortunately are not able to offer that at the health department, but that is a good option for those that have the ability to get their hands on one of those, which has came a long way from the original needle and insulin vial. So it's actually quite amazing how much insulin alone, but also the diabetes health costs in general. The medications, we're seeing a slight decline in the price currently for insulin, which we've not seen in the last couple of years, but it's still quite expensive for those that do not have insurance or those that just rely on it every single day, which all diabetics do. The prescriptions for the medications, the insulin, and other diabetic agents are roughly adding up to about 20% of the total health expenditures in America at this point in time. And it's projected to grow into the billions, which is quite crazy just because of the overall cost of other procedures and medications that we see. But it does affect such a large group of people that we see that the cost is always growing. So diabetes not only affects the individual and their blood sugar, but it also causes many other health issues, especially later in their life. We notice that blindness, stroke, heart attack, and different types of kidney damage all come as a side effect of diabetes. And it's something that they have to manage every day. And if they don't, these illnesses can come faster, which is unfortunate for those individuals. But we see that worldwide, we're talking about almost 400 million people are diagnosed with diabetes. So there's a big number of people that are out there fighting this every day. So they do have to go through a lot in order to do this. And the CDC did release this just this past year that just in America alone, 29 million people have diabetes. So that's basically 1 out of every 11 people are going to be diagnosed with some form of diabetes, whether it be type 1, type 2, or any other form. We do see some complications with diabetes throughout a patient's time. The risk of disease grows 2 to 3 times higher for those that are diabetic. So that just puts them at a higher risk for many different things in the world and that they are exposed to every day. 60 to 70% of people with diabetes have mild to severe nervous system damage. They typically are having this in their fingers, their toes, their feet, their legs, and as time goes on, it's going to continually get worse for these individuals. And by the time these individuals are in their 40s, typically most sensation in their feet has diminished to either a small amount or to nothing, which causes issues in its own. and diabetes is the leading cause of new cases of blindness among individuals 20 to 74, which is quite sad for these individuals that are fighting this disease, but then also having many other issues because of it. So something I do want to bring up is we're fighting a new battle, not only diabetes, but pre-diabetes. This is a huge majority of people that we see coming in that are overweight, do not get the activity amount each week that they need. And so we're seeing that almost 90 million people are diagnosed with prediabetes, but this is actually something that we can fix. It takes some understanding from the patient as well as the healthcare providers to build a plan to get back on their feet and to get healthy. And in doing this, they're going to have to lose some weight, eat healthier, they're going to need to be active. They have to work with us in the healthcare settings to figure out how we're going to manage their potential to diabetes and how we can get them moved out of that range of unhealthiness into a range of healthy habits. Which leads us into our Medicare Diabetes Prevention Program. It is also called MDPP. It is a new program to the Johnston County Health Department. We will be starting this program at the beginning of December, hopefully. It's going to be a hybrid program, online and in person. We're hoping to have this up and running by then. We had tried to do it previously, but just because of COVID issues, we were not able to get it started. But just to give you guys an idea of what this program is about, it's designed to prevent type 2 diabetes, and it's for those individuals that are in the pre-diabetes stage. This is going to be a year-long program. It is free, and there will be incentives given throughout the program to keep participants motivated, but it is a year-long commitment, and it is something that they have to stick with. And so it is something for those that are serious about making a change in their life. Our overall goal for our patients that are going to be participating in this program are going to be losing 5 to 7% of their body weight. And hopefully they're going to gradually increase their physical activity up to about 150 minutes per week. That is our goal. For the qualifications to be in our program, these individuals will need to be at least 18 years old or older, and they cannot already be diagnosed with diabetes. They can be diagnosed with prediabetes, but they will have to also go through a screening process just to make sure that they will be qualified for the program. We are looking for the minority groups, such as the African American community, the Hispanic community, the Asian community. Like I said in the beginning of the presentation, that is the groups that we're seeing a larger number in people coming back with diabetes, type 1 and type 2. So we are trying to reach out to them in particular. And like I said, we will be doing this hybrid. So this means a mixture of in-person and online. When we are going to be in person, we're hoping to be outside so that we're minimizing our time together and in a close proximity. So
Hunter, if one was interested in enrolling or applying for this program, how would they go about doing it?
Yeah, so we have an application that we can send to either their healthcare provider or ours. They can come visit us here at the health department, and we have our own screening process here. Otherwise, we can share it with their provider, and then they will go through some testing, and it's just some blood work tests. And then once they get that information back to us, then we can move forward with enrolling them in the program. All right. Any other questions about MDPP? Awesome. So I'm going to change gears a little bit and move on to smoking. This is something that we at the health department and also the other organizations in the community have been working against. It is in particularly against vaping. It's something that has grown exponentially these last few years, and we're definitely seeing a rise in the younger population as well. And so that's what I'm going to aim at today, just because we will be actually having a tobacco forum next month on November 19th, which I believe Damaris is in here with us as well. So at the end, if Damaris wants to talk about this a little bit, she will be able to inform us all a little bit better on the forum. But I will just go over a few things with you guys in terms of e-cigarettes.
I always smoke when I work. They go together.
In the 1950s, cigarette ads were all about being manly and about being in control. Eventually, the ads were banned because smoking is a health risk. Now, with e-cigarettes, the marketing is back. Wherever you go, it seems vaping is in vogue,
What have I missed?
with some 7 million Europeans making the switch. It's called vaping because the liquid nicotine, which is found in here, vaporizes when you press this button. Now, even though there is no tar and no smoke, there is still nicotine, which is the addictive part. Yet e-cigarette advocates say this is healthier than one of these.
Really not a problem. The research demonstrates that the side stream vapor is not an issue. There are no sort of carcinogens being carried around in that. Certainly nothing on a par with what we see with tobacco smoke and secondhand smoke.
This new spin on an old habit is a marketing goldmine. The e-cigarette market is valued at $2 billion, with the United States accounting for 1/4 of all sales. Then there is the potential for growth, with the industry expected to outperform traditional tobacco within 10 years. While this is igniting worries that will pick up new addicts along the way, already we're seeing celebrities leading the craze.
You're awfully good with that.
E-cigarettes are being presented as this new trendy product, the latest thing that people are trying in social environments. They're referring to celebrities using them. So we're very concerned that possibly by seeing all this exposure to e-cigarette marketing, the lines are being blurred, and that message that smoking kills will get lost.
So I just want to talk about this video for just a minute. The issue that we're having is, again, like the lady said, this is a growing trend, and it is a trend, and our younger age populations obviously are the ones that are going to be exposed to this as they try to fit in with those in the younger age group. Now, the other lady also mentioned that there is no evidence that it has the carcinogens compared to tobacco products, which is currently the debate in terms of we don't know a lot about e-cigarettes, we don't know a lot about vaping, and that is a big problem because we're, again, 25% of the total people vaping are in the United States. And that is scary because we're allowing people to do something that we do not have much research on and something that can cause harm, and they may not even be aware of it. So it is something that we definitely need to stand against. Just so you guys are familiar with a vape pen, this is the typical original version. It does look very similar to a cigarette. But the problem is now we're fighting companies that are coming out with so many different types of vapes that it's hard to keep up, especially in the day and age where everybody is on a computer or on a phone and they're looking for the next best thing. So it's a real headache for those that are trying to fight this battle because there's constantly new and changing ways for them to get around anything that may be put in place against the vapes. How they work is they use nicotine, same as a tobacco product, but it's the liquid version, and it's going to then be dispersed through the pen rather than through the tobacco in a typical cigarette. And that's the difference between the two. It's still just as addictive as the traditional tobacco use. And here is a big question that most people are asking but not really quite sure about. So, and I found it quite interesting as well because it's something that we all do. We call it a vape, but in reality, everybody's kind of confused as to whether it's a gas, a vapor, an aerosol. But these vapes are actually using, it's actually considered an aerosol, not a vape. And the reason why is because it's it's allowing a mixture of the different chemicals, such as I'm sorry, I gotta go back, such as the glycol and glycerin and the nicotine, but also it's containing metals that we're not even sure about yet, nickel, tin, lead, and the batteries in these vapes are also contributing to the white smoke that, or the white clouds that the kids and other vape users are referring to. And the e-cigarettes allow for a much larger, bigger white cloud, which allows them to make circles or blow it in different designs, which can be quite cool for someone that's a young age, which is not a benefit to those trying to show that it's bad, because they're seeing something cool out of something that they don't actually understand as to why it is what it is. And aerosol, in terms of the vape, is the mixture of not only the liquid particles in the gas, but it also is what is mixing in with the air droplets in the water, and that's what causes that white cloud to give off the larger, grander vape cloud. So we have done some studies in North Carolina to see what types of trends in tobacco our middle school and high school students are having. We saw a downward trend for quite a few years in terms of tobacco use, but then right around here, 2009 and 2010, 2011, is when the vape started becoming more popular. And then we see a trend where now our numbers are going back up in terms of how many underage and of age people are actually vaping, which is causing the opposite reaction to the response to quitting, as we would have hoped. E-cigarettes are now the most commonly used tobacco form. They are ahead of cigarettes, cigars, hookahs, any type of older traditional form of tobacco use. They have now surpassed all of them, and they are also the highest rate used among boys, in particular white boys in high school. This is the group that we're now focusing on the most, just because they are tending to be the group that is using and abusing this new technology in the school systems. So North Carolina has actually put in some laws to help combat this, such as the North Carolina, the North Carolina law prohibits e-cigarette sales to minors. That's the Youth Access Law, which has helped out. The age has now increased to 21 instead of 18. So that's trying to help combat the high school students from being able to purchase these types of materials. It also prohibits the use of e-cigarettes on all school campuses as part of the 100% tobacco-free school policy. And we're also seeing that in response at hospitals, many businesses, health departments, doctors' offices, many different facilities, which has also played a huge role, as well as no indoor smoking, such as traditional tobacco as well as the vapes. And now we also have put in place a law in terms of the child-resistant packaging, which allows, which does not allow the packaging to promote or contain material that's going to be particularly drawing towards children of younger age. And the excess tax law also was put in place to help produce a negative effect on those that were purchasing tobacco. It helps cause a deflection in wanting to pay the extra taxes in order to get the materials that they are wanting. And just the reality of e-cigarettes, the use of tobacco products among youth in any form, including e-cigarettes or traditional tobacco, is unsafe. We know that as health educators and others in the health field, but it's our job to now explain to those who are not as informed as others about why this is something we should not be exposing ourselves to. And the e-cigarettes are not currently an FDA-approved quit aid. Many people originally had turned to them from tobacco because they thought they were going to help them to quit smoking. What actually happened is they did quit traditional tobacco, and then they stuck with the vape because of the nicotine that it does produce. The tobacco products are continuously changing. They're very diverse. There's many different flavors, colors, shapes, sizes of vapes, and such as the vape pens, the mods, the jewels, all different forms of them. And then even within traditional tobacco, we see many different flavors, and that causes a want from those that are addicted, and they can't get themselves past it. There's many different stakeholders in this, and it's really hard for the health teams to fight this because they cannot combat with the money that the bigger corporations have. So it's up to the public health departments, it's up to the tobacco forums, it's up to teachers and all of us out there looking out for each other to help slow the increase in tobacco usage. So I know that was a lot, and I was just wondering if anybody has any questions or comments, anything that they would like to add in on. Feel free to now, if you would like.
Yes, and please feel free to unmute yourself or even start your video, whichever you feel most comfortable, or use your chat box. I know, Hunter, I learned a ton about diabetes in this presentation. I thought I knew some. My mother-in-law has type 2 diabetes, and I thought I knew a little bit about it, but I learned so much more. And really thrilled that that pre-diabetic program is getting off the ground in Johnston County. So that's exciting.
Yes, it is very exciting. Yeah, that's the issue right now we're facing. Is it's not even the diabetes, because that is going to be a continuous fight, but those that are falling into that pre-diabetes group, those are the ones that we're trying to target, because those are the ones that we can change their habits around to lower their chances of actually becoming diabetic. Because once they are diagnosed and once they have developed, especially type 2, then that is a lifetime disease, and you're not able to get rid of it. So it's our hope that we can cause a change for not only those individuals, but on a bigger scale.
And Hunter, I have, I guess, a follow-up question. I know that you are working so hard, and all the health educators here in Johnston County with the COVID response. If I am diabetic, or if I am a vape user, am I more susceptible to the negative effects of COVID?
So right now, that is a question that we do ask on our survey. So when we are calling our patients that do come back positive, we go through a whole survey list, and that's the thing. We're not sure at the moment, and that's why we're collecting the data. This is also new, and there isn't a lot of research out on it yet. So what we're doing is collecting that data, so that way researchers can figure out, is this person or that person more susceptible to this disease, and how is it going to affect them long term? Because we have noticed that some individuals that are smoking do not have as much effects as someone sometimes that are totally healthy, but sometimes it's opposite. So, you know, it changes from each individual. So hopefully we get some more data on that and can really learn from this pandemic.
Great. Are there any other questions that anyone may have for Hunter or myself? My work here at Alliance, or the work that Hunter is doing over at the health department?
And I'm not sure if Damaris was still on here, but I didn't know if she would like to share about the tobacco forum at all. She may want to put a few words out there.
Yeah, I'm here. Yeah, so part of what we are doing in Johnston County this year, or next month, it's coming on as faster than expected, is we are having a tobacco forum, and we're having several professionals and panelists and speakers and different people coming to speak on tobacco use, in particular e-cig and vaping, and also having a panel so that we can answer some of the questions that people may have about this, as well as connect you all to some resources that are in the Johnston County area. So should you, if you are working with the health department, or if you have some other needs or requests or want to seek something else out, we'll have some different resources available for people there. So if anyone is interested in that, we can certainly, or I can certainly send you some information if you want to message me here, or I'll put my email in the chat if anyone has any questions or wants to get involved.
Sure, I am happy for the individuals that are on the call or on the Zoom meeting. Hunter, I can always share your slides. I can put those in a PDF if you don't mind doing that, or I can do that for you and send those out to individuals that are on the call. And Damaris, anything that you would like to promote in reference to the tobacco forum, I'm happy to do that as well.
I just want to say I was very pleased with Hunter's presentation. Learned a lot. You're very knowledgeable. Thank you
so much. It's been a busy week. I was talking with Becky. It's been a lot here at the health department. We are very, very, very busy, and the two other health educators are currently not available because of their efforts. So I was glad I was able to put this together real quick for you all, and just share a little bit about what we have here, because it is something about the health department that most people do not know what we have here. And we are a good resource for so many people if they just know about it. So that's why sharing these types of clips, even if it is to a small group, if they can, if it can just be passed on to others, then that's a big change for everyone. So I appreciate that. Thank you.
Yeah,
great, Hunter. And Hunter, there is a question in the chat. Are there foods that were once good for diabetes that are now no longer, I guess, good? So, a diabetic diet or that type of thing. Can you talk a little bit about foods and diabetics?
Yeah. So when we're sitting down with our patients that come in, who whether they are pre-diabetic or diabetic, those that are high in sugars, we try to avoid. Those that have natural sugars, fruits, vegetables, and some carbs are all good as long as it's balanced. There's nothing that we say someone specifically cannot have. It's more so of a balance of healthy foods and those that may end up being a little bit higher in sugars. Because what you're doing is playing a balancing game throughout the day of how you're going to keep those numbers at that 70 to 100 in terms of glucose levels in your body. So it's really just a balancing game. If you're able to realize, hey, if I eat this now, I may not be able to eat something sweet again later. So it's really, in terms of that, a balancing game.
I just wanted to say that I have family members, my parents who are diabetic. I have a brother who is, and it's just trying to avoid it, and avoid those things that plague my family. And so yeah, I'm on it, Hunter. So thank you. I appreciate it.
Manuel, as you know, knowledge is power. So the first stage is knowing about it, and then implementing what you now know.
That's right. That's right, Becky. That's right. So thank you both.
Yeah, absolutely. So yeah, if anybody does know anybody that is in that pre-diabetes stage, please send them that our way, because we have so much information we can share them with the MDPP program. Unfortunately, we were not able to start it in October like we had hoped to, but we're hoping that the word gets out there and we're able to start this in December, because it is a awesome program, and it can make a huge difference in someone's life that is on the edge of becoming diabetic. So if you guys know anybody, please just send them our way. Even if it's just a talk, anything is better than nothing.
Hunter, is there a flyer associated with that program that I could get access to?
Yeah, I will send you, I'll send the flyer as well. I will update it a little bit because it does not have the new dates on it.
Right.
We have not specifically put a date on it yet because of the just in the change of when it's going to actually happen. We have a coordinator that works out of another county that's actually working with us, and she is over this program for our district. So if once she lets us know when we can go ahead and put a date down, that's when we'll go ahead and start promoting it again for
Fantastic, fantastic. And another question, are there sweeteners that are better than others? You talk about, stevia or
Yep.
the blue packet and the pink packet. Are there
I know when you walk into a restaurant, you got the pink and the yellow. That's typically
right, exactly.
what you got. So there is not a huge difference in them. It's again going to be the balance, because it's not a natural sugar. It is something that's made specifically for people that are trying to control their sugar. So it's one of those things that you have to realize that what you're putting in your body. Maybe you want to choose a natural sugar, such as a honey or something of that nature. Especially if you're doing tea, try to put honey instead of a preservative or a non-natural sugar, just because that balances it out, and you're putting something that's actually going to benefit you in more ways than just enhancing the sweetness of your drink.
That's a great recommendation. Okay.
Yeah. So we try to say anything that's going to be natural is going to obviously give you better health benefits. All right.
Thank you. Anything else out there for the greater good? All questions and comments are welcome.
Yeah, Hunter, I've just recently started drinking Diet Mountain Dew.
Yep.
As an alternative or an addition to my daily caffeine intake. So what do you think about that? And I drink black coffee, so coffee in it at all. Iced coffee at that. So
yeah, so we all have our battles. The diet obviously is going to be much, much better than the traditional version of Mountain Dew. But I will say, as long as it's in a, as long as you have a control on it, if you're going to have one drink a day, that's acceptable. It's when you start getting to that five or more range, that's when we're really seeing those individuals have the negative effects, whether it be diet or regular. So just keeping a control and realizing, hey, I need to watch what I'm putting into my body if I want to get the positive effects out of it. So just keep in mind, it's obviously a better option of the two, but again, it's still a soda. It still has many different ingredients that are not necessarily great for the body.
thank you, Hunter.
Absolutely.
Fantastic. And then lastly, Hunter, if you wouldn't mind just putting your email in the chat box. I'm also going to include mine. If there are things that come up, an hour from now or tomorrow or even a week from now, please feel free to reach out to either one of us. I know oftentimes we work closely together. And so if I don't have the answer, then I will try to seek it out elsewhere. And I know our health department does the same thing. We really work in partnership with each other. And again, Hunter, I'm so thankful for the time that you carved out for us, for our small group today, because I do know how busy you all are, and appreciate the work that you do on a daily basis for our community.
Absolutely. Thank you for letting me share this with everyone.
So on that note, I'm going to finish putting my email in here, and I will stop recording and close the session. Have a great weekend, all.
Thank you, guys. Have fun.
Thank you.
Bye.
Excellent job, Hunter.
Thank you, Damaris.